Welcome to our deep dive on the early signs of colon cancer. Imagine this: a 42-year-old teacher named Sarah feels a little more drained than usual and starts leaving food on her plate. Nothing dramatic, nothing that seems urgent. Half a year later, she learns it's stage 3 colon cancer. The warning signs were there the whole time, hiding in plain view. Here's the part almost no one talks about. Colon cancer is a shapeshifter. People think of obvious red flags like blood in the stool or severe constipation. But this disease often speaks in quieter ways. There are 14 understated signals that slip past countless patients, and at times, even experienced clinicians. These aren't the headline symptoms you see on generic health pages. They're the soft cues gastroenterologists wish more people recognized before the disease advances. Some of these clues are so ordinary you might chalk them up to stress getting older or eating poorly. Today we're bringing forward evidence from top medical journals showing how colon cancer can announce itself months before the classic symptoms arrive. By the time we finish, you'll have practical knowledge that could protect your life or the life of someone close to you. Let's begin with the first silent signal: changes in bowel habits that fluctuate. It's the most frequently missed indicator in colon cancer detection and is present in up to 75% of cases. Changes in bowel habits that fluctuate. A back-and-forth pattern of diarrhea and constipation is an underappreciated warning sign, often blamed on diet stress or irritable bowel syndrome. Gastroenterology literature indicates that these swings can reflect a partial blockage from a growing tumor. The mechanism is variability in obstruction. When a lesion narrows the colon, material backs up behind it, producing constipation. Once pressure rises, enough liquid stool seeps around the narrowing, resulting in sudden, sometimes explosive diarrhea. Cancer-related bowel shifts differ from benign conditions in their persistence and steady worsening. IBS symptoms typically improve with dietary adjustments or medication, while cancer-driven changes progress despite these measures. The alternating pattern usually unfolds over months, sporadic at first, then increasingly frequent and pronounced. Accompanying features can include cramping, bloating, and a lingering sense of incomplete evacuation. Many people describe a fundamental departure from their lifelong bowel rhythm. If you've noticed substantial swings in frequency or consistency moving between extremes for longer than 6 weeks, seek medical evaluation, especially if you're over 45 or have a family history of colorectal cancer. In these scenarios, a colonoscopy may be critical for timely diagnosis. 2. Back or pelvic pain. Back or pelvic pain can signal tumor growth, encroaching on nearby structures, often a later presentation, but still within treatable territory. Pain medicine literature shows this arises when lesions impinge on neural pathways, particularly the lumbar and sacral roots. Direct compression along with inflammatory changes in adjacent tissues generates characteristic discomfort. Tumors in the rectum and sigmoid colon are most frequently implicated because of their proximity to the sacral plexus. The pain is typically a deep, persistent ache that responds poorly to standard analgesics. Cancer-related spinal or pelvic pain follows a recognizable profile. It tends to worsen at night, fails to improve with simple positions as changes, and may occur alongside shifts in bowel habits or urinary function. A concerning pattern emerges when the pain disrupts sleep or daily activities. Progression often starts with intermittent twinges that gradually become continuous and more intense. If nerve compression develops, the pain can radiate down the legs or be accompanied by numbness or tingling. Any unexplained back or pelvic pain lasting longer than 4 weeks, especially in adults over 50, warrants comprehensive evaluation. Malignancy should be included in the differential to ensure accurate diagnosis and timely treatment planning. 3. Unexplained low-grade fever. On and off low fevers can be a subtle expression of colon cancer, easily mistaken for minor bugs. Immunology findings indicate that even early tumors can provoke localized inflammation that spills over, systemically nudging body temperature upward. As the immune system reacts to abnormal cells, tumors shed inflammatory mediators and cellular byproducts that activate immune pathways, producing periodic temperature rises, typically around 99 to 101 degree. These episodes often come in waves: a few days of low fever, a lull, then a return weeks later. Cancer-related fevers differ from infectious ones in their pattern and the company they keep. They tend to occur without the hallmark signs of a cold or flu, no sore throat cough, or acute gastrointestinal upset. Night sweats or a general sense of malaise may appear, but there's usually no abrupt onset or specific illness symptoms. Many people notice the temperature bumps in the evening or overnight, reflecting normal circadian rhythms, but exceeding the usual daily swing. What raises concern is persistence or recurrence without a clear cause. If low-grade fevers recur for more than 3 weeks, especially alongside other quiet signals like unexplained fatigue or weight loss, a thorough medical workup, including screening for malignancy, becomes important. 4. Reduced appetite or feeling full quickly. Feeling stuffed after only a small amount of food can signal developing colon cancer through several pathways. Oncology nutrition research shows that growing tumors provoke inflammatory cytokines that influence the brain's appetite centers, disturbing the normal balance of hormones, such as ghrelin and leptin, that regulate hunger and satiety. Partial narrowing of the bowel also means even modest meals can trigger a sense of fullness as the gut struggles to move contents along. In addition, cancer cells release substances that disrupt digestion and nutrient absorption, so the body feels done with less intake. This sets up a concerning spiral in which eating less drives weight loss and growing weakness. Because the shift is gradual, it can be hard to recognize at first. Many people don't register the change until portion sizes have quietly shrunk over months, and it's often family members who point out that meals are much smaller than before. If you've lost interest in food or repeatedly feel full after about half your usual portion for longer than a month, it's time for a medical evaluation. When early satiety occurs alongside weight loss or persistent fatigue, the concern rises further and warrants prompt investigation. 5. Unexplained nausea and vomiting. Nausea and vomiting can reflect a tumor causing a partial bowel blockage that forces digestive contents to move in reverse. Surgical emergency literature notes this arises when a growing mass markedly narrows the intestinal passage. When peristalsis, the rhythmic waves that propel food, meets a narrowing pressure, builds behind the pinch point, pushing contents backward and triggering nausea. It often starts quietly as mild queasiness after meals that people blame on sensitivities. Cancer-related nausea tends to track with eating patterns and gradually intensifies. Many develop early satiety, feeling full after only small portions, followed by nausea, as a partially obstructed intestine struggles to process food. The timing can offer clues. Nausea that appears several hours after eating leans towards small bowel involvement, whereas queasiness immediately after meals points more to gastric problems. Regardless, any unexplained pattern that lasts beyond 2 weeks, especially when paired with changes in bowel habits or abdominal discomfort, warrants evaluation. A shift from occasional post-meal unease to more frequent episodes over several weeks shouldn't be brushed off as stress or diet if it is persistent and clearly worsening. 6. Changes in stool color. A shift toward darker Tory stools can signal bleeding higher up in the colon that isn't obvious to the eye. When blood from tumors in the ascending or transverse colon travels through the digestive tract, it mixes with acids and enzymes, undergoing chemical changes along the way. The American Cancer Society notes that bleeding from the right side of the colon often produces melena, a dark tar-like stool, because the blood has more time to interact with digestive fluids. Unlike bright red bleeding from the rectum, this slow hidden loss can persist for months unnoticed. Even small daily losses add up, gradually depleting iron stores and leading to anemia. Early on, color shifts may be subtle. Stools may look deeper brown rather than the dramatic black associated with heavier bleeding. Many people blame the change on iron tablets, medications, or certain foods. The problem is the intermittent nature of the bleeding, which makes it easy to overlook. Fecal occult blood tests can pick up hidden blood, even when there's no visible change. If stools are consistently darker without a clear dietary or medication explanation, especially if fatigue or other symptoms are present, seek prompt medical evaluation for proper assessment and timely intervention. 7. Subtle abdominal cramps. In its early stages, colon cancer often shows up as mild, repeatable abdominal discomfort, rather than intense pain. Gastroenterology literature links these cramps to tumor-driven inflammation and low-grade blockage that may not produce dramatic symptoms. The sensation is typically an intermittent dull ache in the lower abdomen, not a sharp stab. When a growth narrows the bowel, normal peristalsis must strain to move contents through the bottleneck, and that extra effort can trigger cramping. The confusion comes from how ordinary it feels. Many people attribute the twinges to gas, something they ate, or everyday stress. Cancer-related cramping, however, follows recognizably different patterns. It returns to the same spot, tends to intensify after meals, and fails to settle with the usual fixes. Changing position may offer brief relief as material shifts around a partial obstruction. As tumors develop, they can also irritate nerve pathways within the intestinal wall, producing referred pain that clouds where the problem truly lies. Recurrent discomfort in the same location persisting beyond 3 weeks, especially if it is steadily worsening, should raise concern. Pain that begins to disturb sleep or limit daily activities signals a more serious trajectory and warrants a comprehensive medical workup with malignancy included in the differential. 8. Frequent urge to defecate. A persistent urge to pass stool without relief, tenesmus strongly points to problems in the rectum or distal colon. The mechanism is straightforward. Tumors in these regions inflame and irritate the bowel, sending the nervous system misleading signals that evacuation is incomplete. Studies show tenesmus is especially associated with rectal and left-sided colon cancers. The mass and surrounding inflammation activate stretch receptors in the rectal wall, generating repeated false alarms. People get caught in frustrating cycles of urgency with little or no output. This symptom typically builds over time. At first, it follows normal bowel movements. Then it becomes near constant. Patients often describe unrelenting pressure or fullness that never resolves. Unlike the urgent feeling during infectious diarrhea, tenesmus persists even when the rectum is empty. When it occurs alongside mucus or small amounts of bleeding, guidelines strongly favor endoscopic evaluation. The red flag pattern is tenesmus lasting longer than 2 weeks and unresponsive to hemorrhoid treatments. Early recognition and prompt medical review improve the odds of detecting rectal cancers at more treatable stages. 9. Ongoing bloating or gas. Long-lasting bloating is common. Women's Health Initiative data on more than 400 colorectal cancer survivors found 54% experienced it, yet many people chalk it up to food choices. In some cases, it reflects developing structural changes. As a tumor enlarges, it can partially narrow the intestinal lumen, trapping gas and slowing transit. The result is persistent fullness and excess gas that fail to resolve with usual fixes. Research on malignant bowel obstruction notes that while complete blockage tends to appear later, subtler shifts in gas patterns and notable bloating may emerge months earlier. Local inflammation around a growing lesion can also disrupt motility, leading to irregular movement of gas. What separates cancer-related bloating from everyday digestive discomfort is the steady worsening course. Typical bloating improves with dietary adjustments, probiotics, or agents like simethicone. Cancer-linked bloating progresses despite those measures. The worrisome pattern is daily bloating for more than 4 weeks that does not respond to elimination, diets, probiotics, or over-the-counter remedies. If you've cycled through several approaches without relief, it's time for a medical assessment to rule out structural causes. 10. Narrow or ribbon-like stools. Although some research questions how dependable stool shape is as a marker, A sustained pattern of thin stools, especially alongside other symptoms, can point to structural problems in the colon. The crucial factor is persistence, not a one-off change. As tumors expand inside the bowel, they can create partial blockages that force stool through a tighter channel. This mechanical narrowing often produces a pencil-thin or ribbon-like appearance. Gastroenterology studies note that brief fluctuations are common and usually harmless, but a continuing trend towards slimmer stools over several weeks deserves attention. Specialists at Houston Methodist emphasize telling normal variability from worrisome shifts. Everyday influences like diet, fiber intake, and short-lived digestive upsets regularly alter stool texture. By contrast, consistently narrow stools lasting longer than 2 weeks, particularly when accompanied by changes in bowel frequency or abdominal discomfort, should prompt medical evaluation. Cancers on the left side of the colon, especially in the sigmoid segment where the diameter is smaller, are more likely to alter stool shape. Right-sided tumors where the lumen is wider rarely produce this sign. If you observe ongoing shape changes for more than 2 weeks, keep a simple log of what you're seeing and bring it to your healthcare provider for discussion. 11. Unexplained weight loss. Weight that drops without effort is often praised instead of probed, yet research published in JAMA Network Open following roughly 11,000 people shows that meaningful weight loss without any change in diet can foreshadow developing cancer months before other signs appear. Cancer cells run hot metabolically, pulling in large amounts of glucose and nutrients to fuel rapid expansion. At the same time, tumors release inflammatory cytokines that reset your metabolic controls, pushing the body to cannibalize muscle and fat, even when you're eating normally. This loss tends to target lean tissue more than fat, which translates into weakness and low energy. Unlike purposeful weight reduction, cancer-related loss often happens while appetite is still intact at the beginning. Evidence suggests this process can start 6 to 12 months before a typical colon cancer diagnosis. Because it unfolds slowly, it's easy to overlook until the scale shows 10 to 15 pounds gone over a span of months, often noticed by family before the individual realizes it. Gastroenterology groups stress that an unintentional drop of more than 5% of body weight over 6 months warrants immediate evaluation. If loved ones have mentioned you look thinner or your clothing fits looser, despite no deliberate diet changes, treat those observations as important clues rather than coincidences. 12. Chronic fatigue. When there's no obvious explanation, cancer-related fatigue is a different creature from everyday tiredness. Data from functional assessment of cancer. Therapy fatigue studies show this profound exhaustion can appear even before any chemotherapy, often reflecting occult blood loss and tumor-driven metabolic shifts. People describe a near-paralyzing weariness that persists no matter how well they sleep. Findings from the European Organization for Research and Treatment of Cancer indicate this depletion arises from cancer-induced inflammation, frequently compounded by iron deficiency. The real risk is how easily it's brushed aside. Many women chalk it up to hormonal fluctuations, while many men blame job pressure. Evidence reported in the Annals of Oncology demonstrates that fatigue present at baseline prior to treatment strongly correlates with more advanced disease. Biologically, cancer cells divert glucose and nutrients to fuel their growth and ignite chronic inflammatory pathways, leaving the immune system constantly activated and your energy reserves drained. The telltale difference is functional cancer. Fatigue disrupts daily life and does not respond to extra sleep or simple lifestyle tweaks. If you've had persistent unexplained exhaustion for longer than 3 weeks, particularly if you're over 45, seek prompt medical evaluation. 13. Persistent iron deficiency anemia. Most people shrug this off as ordinary tiredness, yet iron deficiency anemia is linked to a striking 31-fold elevation in the likelihood of gastrointestinal cancer, according to findings published in Clinical and Diagnostic Pathology. Here's how it unfolds beneath the radar colon. Tumors can leak tiny amounts of blood day after day, quietly draining iron reserves over many months. There's no dramatic hemorrhage to spot, just invisible steady loss that your body accommodates, so gradually you start to believe feeling wiped out is normal. Evidence shows that before surgery, anemia appears in roughly 50% of patients with colon cancer and in about 20% of those with rectal cancer. Research from the National Cancer Institute indicates that this trickle of bleeding is often too slight for standard stool screening to pick up, which is precisely why it's such a treacherous early clue. The real danger lies in the slow adaptation as your red blood cell count declines, bit by bit. You adjust to chronic fatigue and blame it on a hectic life or getting older. For that reason, many gastroenterologists now treat unexplained iron deficiency anemia in adults over 50 as an urgent warning sign that warrants prompt colonoscopy. Remember that early-stage colon cancer is highly treatable and often managed with minimally invasive surgery that yields excellent outcomes. The difference comes from recognizing patterns and acting before severe symptoms appear. If this video clarified these warning signs for you, type helpful in the comments. It encourages us to create more potentially life-saving content. Please like the video so it can reach people who may be experiencing these signs without realizing their significance. Share it with family and friends and subscribe for more essential health insights. Thank you for taking the time to learn about these critical signals. Your awareness could truly save a life.